Welcome to Health and Living with me, Norma Kawenjo. Today we're sitting with Mr. Romio Matshazi of Activate Zimbabwe, and we're going to discuss drugs and their negative effects on the community and our health overall. Welcome.
Thank you.
To start off, can you tell us about your organization, Activate Zimbabwe, and your role in it?
Yes, Active Youth Zimbabwe, it is a youth organization. It got established in 2012 May as a self-help group. Then in 2014, we got registered with the Ministry of Youth and Zimbabwe Youth Council. And then in 2016, March 01, we transformed into a trust. We got registered as a trust. Okay. So that's the history of Active Youth Zimbabwe. And actually we do advocacy, research, training, education on various programs, which include drug, alcohol and substance abuse, youth for human rights, mental health or mental illness, and then moral values.
Okay, and what is your role at Activate Zimbabwe?
I'm one of the founding members, and I serve the organization as the director.
Okay, so what is a drug? When we talk about drug abuse, first of all, what is a drug?
Yeah, drugs are substances that are not food or nutrition, that when put into the body, they changes the way the body works, the way the person feels or thinks. Okay. So meaning that anything taken into the body and alters or changes the behavior of someone, that is a drug.
Okay, and then drug abuse then would be?
Drug abuse, it's a situation or a process whereby people, they misuse drugs. They take drugs not for a good reason. Yeah, it's taking something for a wrong reason, yeah.
Okay, so in your advocacy work, in your work with the community so far, what have you seen as maybe the reasons that people would abuse drugs here in our local setting? Yeah,
we realize that youngsters, they abuse drugs because of various things. According to the survey, the baseline assessment survey we carried out in 2015 and the other researches that we have been carrying out, we realized that youngsters, they abused or they start taking drugs because of lack of entertainment. Looking into our city council recreational centers, they are no longer vibrant as long back.
Okay.
So that's one of the important reasons in our local arena. As well as we realize that they take drugs because they want to experiment. Young people, they take drugs because they want to socialize, they want to fit in, they want to rebuild the law. And yeah, due to peer pressure, those are some of the reasons.
Okay. So what drugs are abused most commonly here for us?
Yes, I will stick to our survey results, because we have researched actually and we have got the data which we compiled after this survey. We realized that marijuana, mbanje, it is the commonly abused drug in our society, especially in Bulawayo, because the survey was a provincial survey. Mbanje, it is commonly abused because of its access, its accessibility. It's very accessible here in the country. People, they farm, they grow it. It's easily accessed and it is cheap. Yeah. And secondly, we realized that alcohol becomes the number 2 of the drugs abused in the market, especially hot spirits, Turkeys, hot stuffs, and these other hot stuff. Yeah. Okay. And then number 3, we came up with Bronclear, which is a Bronco, the coffee syrup, which is abused, which is misused by drug addicts or those people who take drugs. Sometimes they treat these drugs, they mix them with other drugs.
Okay.
Yes. And this time around, I'm hearing that there is another drug which is on the market, which becomes diazepam, and it becomes a mentally healthy tablets. These are tablets which are given to mentally healthy people who are mentally disturbed. And then when they come out from the mental health institutions, they sell the drugs, and the drugs, you will find out that it is killing and disturbing the future of our young people.
Okay.
Yes.
So demographically, what are the ages? From your survey, these people that were abusing drugs, what ages were they normally?
As young as 11 to 11, 17, up to 24 years. Okay. Yeah. So we realized that people, they start abusing drugs as young as 11, 12, somewhere there. Yeah. That's grade 7, Form 1, somewhere there.
Yeah.
Yeah.
Very young.
Yes.
So from a health perspective then, how is their health affected? Let's take like marijuana for instance. What are the health, what is happening to the people's health when they take these drugs?
When it comes to marijuana and the rest of the drugs, actually all drugs are poisons. They've residues, poison in them. And that actually, whichever drug, when taken into the body, determines the effect. The small amount acts as a sedative, meaning that it speeds you up. And the larger amount acts as a stimulant that suppresses you. So this means the drug residues, they get stored in the fatty tissues of the body or blood cells of an individual or the taker, the drug abuser. Okay. So meaning that at the end of the day, the residues, they directly affect the drug abuser. They affect them directly or indirectly, even they are no longer taking those drugs. Okay. Yeah. So at the end of the day, we realize that according to other survey from other sources, we realize that some people taken into mental health hospitals who are mentally disturbed, they are there due to drug abuse. So we agree that drug abuse also can cause mental illness. Okay. Yes.
And how would someone know if someone they're close to is a drug abuser?
Yeah, there are a number of side effects and signs and symptoms that you can tell, that you can observe, that can tell you that the person is abusing drugs. Normally, you see them thin. Some they don't eat. Actually, it varies with the drug. Okay. Some drugs, actually, if you take them, you fail to. You fail to eat, to have appetite. Okay. You see, drugs like Bronclear and coffee syrups. Coffee syrup or Bronclear takers, they don't like to eat. They don't want food, and they become thin. You see, their body changes. And then other drugs like marijuana, definitely they gives you appetite, but at the end of the day, that's mental illness. If the person is at school, the learning performance, it goes down. So these are some of the reasons, as well as amanxeba. And that can tell you that this person may be abusing drugs. Okay. Because I've got a number of guys whom I know actually, who some of them, they don't have amazinyo, they don't have teeth. So due to fighting, because actually whichever drugs taken, you even become violent. And during the violence, maybe you get maybe losing your eyes or some of your body parts. So those are some of the things or that you can observe for you to quickly realize and notice if this person, is he taking drugs or not? Okay. Yes. At times, some people take drugs, you see them, actually it varies with the drugs. Some of them, you see them talkative. I'm not saying those who are talkative, they are taking drugs. I'm not saying that. But you know, like you're at home, you're a parent. This is why we encourage parents to guide, to have a parental guidance to their kids. Whenever you know how your kids or kid behave, you can tell. Even sometimes some of them, they have strange sleeping hours. Let's say ubelala ngabo 7. Let's say selala ngama 12 or 1. Or maybe ubelala ngabo 8, 9. Ugcine selala ngabo 5 or 4. So those are some of the things, you know. There are a number of things that actually one can trace and say there's something is happening from the person.
You're watching Health and Living with me, Norma Kamendlo. Today we are with Romio Matshazi of Active Youth Zim. Please join us after the break. What can CITE do for you? The Center for Innovation and Technology offers a business opportunity to engage directly with your market online. We also offer media training workshops, live streaming, documentary production, and events management. For more information, visit our website and social media platforms. Don't forget to like, comment, and share. With CITE, you'll never miss a thing. Thank you for joining us. We're still here with Romio Matshazi, and we're still discussing drugs and their effects on health. So, Romio, what help do you have for drug abusers and their families?
Yeah, actually, being here on this platform, it helps us disseminate information about drug, alcohol, and substance abuse. I'm sure majority of people across the world, they are watching at this event, and we normally get the calls, information. They contact us for agent help for their youngsters, their kids. And normally, what we do as an active youth Zimbabwe, we offer addiction counseling to them. And unfortunately, we haven't got a drug rehabilitation center which is proper for the drug addicts. And we realize that most of the families, they seek for a really rehabilitation services. And we are, as an organization, trying to come up with one anytime soon or next year or so. So we realize that some of the drug addicts, they have taken drugs since long back and they are more affected. And there is a need for them to go through a rehabilitation or detoxification processes for them to get help, because without any drug rehabilitation program or services, there's no help they can get. Because like I said earlier on about the drug residues, that poisons residues which get stored in the fatty tissues of the body and the blood cells, for them to come out from the blood cells and the body, and for the person to get salvaged and be happy again, those residues, they should come out through a drug withdrawal or detoxification program. And that's the challenge we are facing as a country or as communities. We really seek to come up with drug rehabilitation centers across the communities and societies.
Okay, so what does addiction counseling entail exactly?
Actually, the addiction counseling, it helps us as experts to know and trace the drugs that the addict has been taking and how much of them are they in the body, because also we do drug addiction screening and testing. So all that helps us to know how much drug is in the body. And we normally, in that, guide us to know, because some of these drugs, there are some hard drugs and more severe drugs. So it gives us guidance to know which drugs can be handled fast, and some truly they are not easily handled. So for one to get a solution, we normally refer them to South Africa, because that's where there are drug rehabilitation centers.
Oh,
yes,
okay.
because we currently don't do every donkey job. We don't do everything. Yeah, we refer them to somewhere else because there's something that we can't handle at this juncture.
So you mentioned screening and testing. Is it voluntary, or is it like the mother's like, my child is a drug addict, and brings them by force?
It's voluntary. Those who want to come for drug testing and screening, they normally come because we've got devices which helps us to come up with accurate results. Yeah, but some schools, teachers, and communities, they call us as an organization to attend to such circumstances and scenarios whereby they'll be willing for their team, class, or communities to be tested.
Okay.
Yes, so for them to know their status on drug, alcohol, and substance abuse.
Okay, and you mentioned a detox. I know you say you don't currently have it, but what is your idea for the future when you do?
Yes, actually, like we are willing to come up with a hospital, a drug rehabilitation center, whereby we'll be having a medical center, a drug or purification program center, whereby drug addicts will be coming in for the help.
Okay.
And that's where detoxification, sauna, and other programs will be happening for us to help people get off drugs, or help those who are already into drugs or having damaged lives to recover back.
Okay.
Yes, we want to bring them to the society.
Okay.
Yes, and within the center, I'm sure we'll be also doing the permaculture programs and projects whereby we empower them through livelihood projects and the stuff, because the space we got is quite big. So we've got a space whereby we'll be doing income generating projects whereby when the inmates, they'll be within the site, will be empowering them with projects so that when they go out, they'll be having something to do, because we realize that some of these guys, they are saying we are into drugs because we don't have anything to do. So I will be trying to empower them to create employment for themselves.
Okay.
Yeah.
So I know you have foreign partners, other organizations that help you, and they're based in countries like maybe the States or Canada or something.
Yes.
And their drug abuse landscape is kind of different from ours.
Yes.
So how then do you guys work together? How is the collaboration?
Yes, we do have a number of organizations, likes of Foundation for a Drug-Free World, who normally donates material that we are using currently. We have Nakanon, who are all strictly on drug rehabilitation services, and other organizations. We realize that some of the material we receive from drug-free world, like of Ritalin abuse and other LSD drugs, they don't exist much here. But we feel that it is important for us to have to have knowledge and skills on how to handle that situation, because as we survive, as we live, we have relatives in the diasporian countries. One day they will bring those drugs locally. So when we are already imparted with the knowledge and we have the skills, it will be easy for us to attack the problem. Yes.
Very clever.
Yeah.
Okay, so in conclusion, what do you want to say to someone abusing drugs? Someone who's at home now thinking, I can't get out of this, I've tried, I've been trying. What do you want to say to them?
Actually, drugs are poisons. Drugs kills. And playing with drugs is like playing with fire. Drugs are bad. Drugs, they destroy creativity. Drugs, they destroy young lives, because this number of other guys who are in the prison setup, they are there because of drug abuse. People take drugs, they are more prone to engage in criminal conduct. And youngsters, young people, today's children will become tomorrow's civilization. We expect them to be tomorrow's leaders. But when they start abusing drugs at a tender age, at a younger age, meaning that we won't be having future leaders. So I urge them to stay drug-free and say no to drugs and say yes to life.
Thank you for joining us, Romeo.
Okay.
You've been watching Health and Living with me, Norma Kawenjo. Say no to drugs. Drugs destroy lives.